Looking for an alternative and less invasive way to obtain blood gas in infants? Well, capillary blood gas sampling is the way to go. Properly obtained capillary blood from a well-perfused patient can provide clinically useful estimates of arterial pH and PCO2 levels. However, since capillary PO2 is lower than PaO2 values, it is of little value in estimating arterial oxygenation, and pulse oximetry is required in order to monitor O2 saturation. Capillary blood gas sampling is indicated when a measurement of acid-base balance or pulmonary gas exchange is required. During this procedure, clinicians must be very cautious when using capillary blood gases to guide clinical decisions. CBG sampling should not be performed when an accurate assessment of oxygenation or ABG values is necessary. Capillary puncture is contraindicated in neonates younger than 24 hours. Newborns have low systemic output, and vasoconstriction tends to be maximal during this stage, secondary to a decrease in environmental temperature and an increase in circulating catecholamines. Therefore, the accuracy of CBG values is severely reduced by the presence of hypotension, hypothermia, hypovolemia, and lack of perfusion. Polycythemia is also contraindicated due to short clotting times. While performing the procedure, we should avoid areas that are inflamed, infected, calloused, or swollen. In addition, complications of CBG sampling are infection, scarring, nerve and artery damage, bruising, burns secondary to heel warming, and the patient's condition may not be accurately reflected.
Select the puncture site and warm the area for 5 to 10 minutes with a commercial warming pack to 37-45 degrees Celsius. The primary puncture site is the posterolateral part of the foot, and the secondary site is at the ear lobes. Avoid previous puncture sites and palmar fleshy areas as they pose a higher risk of nerve damage. Give a 12 to 24% sucrose solution pacifier 2 minutes before the procedure. Wash hands and adhere to universal precautions of blood-borne pathogens using properly fitting examination gloves. Remove the warming device. Clean the area with chlorhexidine. Immobilize the area by properly grasping the foot and stabilize the area by anchoring the hand or foot on a hard surface. Use an assistant to help immobilize the limb if required. Restrain the infants by swaddling them in a blanket. Position and hold the lancet to the skin area and press the activator. Have the lancet advanced and withdrawn. Correct depth depends on the infant, but 1 to 2 millimeters is generally sufficient to produce a free-flowing drop of blood. Do not slice, dig, or have multiple punctures. Wipe away the first drop of blood, which may be contaminated with intracellular, interstitial, or lymphatic fluids, with a dry, sterile gauze pad. Apply moderate pressure to the heel without massaging or squeezing until a free-flowing drop of blood appears. Collect the blood by placing the tip of the capillary tube into the blood droplet without touching the puncture wound. Hold the capillary tube angled horizontally or slightly downward from the neonate. Keep the tube in contact with the blood until the required amount of blood fills the tube, usually 40 to 125 microliters. Maintaining contact with the droplet limits unnecessary exposure to air and reduces the incidence of air bubbles in the sample. Apply pressure to the puncture site with a sterile gauze pad until the blood stops. Use an adhesive bandage or cotton wool tape to place over the location.
Label the tube. Lastly, run the gas to the lab.